Assalamualaikum everyone. My name Muhammad Aiman Faris bin Muhammad Idrus. I will tell you about what is knee injury and what special test for knee injury. Okay, what is knee injury? Knee injury is many major structure make up your knee, all of which may be damaged. Fracture around the knee, dislocation, and sprain, tear in soft tissue such as ligament or the most common knee injury. In certain cases, more than one fracture in the knee is involved in accident. The most common symptoms of knee injury are pain and swelling. What is special term for knee injury? A complete knee examination is always done for a knee complaint. Both of your knee will be checked and the result for the injured knee will be compared to those of the healthy knee. For the knee ligament tests include valgus and varus test, posterior drawer test, LUQMAN test, anterior drawer test, pivot shift test. For the meniscal problem, McMurray test and measure for the looseness of your knee, orthopedic testing.
Hi, Assalamualaikum. My name is ALIZA binti ADNAN. Today, I will present about anatomy of knee injury. The knee is the largest joint in the body and one of the most easily injured. It is made up of four main things. First is bone, second is cartilage, ligament, and tendons. Okay, first is bone. Three bones made to the form your knee joint. Your thigh bone, femur, shin bone, tibia, and kneecap patella. Okay, second is articular cartilage, the end of the femur and tibia, and the back of the patella are covered with articular cartilage. This slippery substance have your knee bone glide smoothly across each other as you bend or straighten your leg. Okay, next is ligament. Bone are connected to other bone by ligament. This is a main ligament in your knee, like some rope to hold the bone together and keep your knee stable. Have a two type of a ligament. Okay, first is collateral ligaments. These are found on the side of your knee. The medial collateral ligament is on the inside of your knee, and the lateral collateral ligament is on the outside. They control the sideway motion of your knee and the brace in the against unusual movements. Okay, next is cruciate ligaments. These are found inside your knee joint. They across each other form an X with the anterior cruciate ligament in front and the posterior cruciate ligament in back. The cruciate ligament control the back and the forward motion of your knee. Okay, lastly is tendon. Muscle are connected to bone by tendon. The quadricep tendon connect the muscle in the front of your thigh to your patella. Searching for your patella to your shin bone is the patella tendons.
Hi, Assalamualaikum. My name is LUQMAN HAIKAL bin ROZAINOR. I'm from RSR 2433A. Okay, on this slide, I will show you and explain to you about the common injury of the knee, which is the most injury that happen directly or indirectly to the knee. Okay, for the first common injury that happen to the knee is the patellofemoral syndrome. It is known as a disease that causes pain in front of knee and around the patella. It is also called as jumper knee or runner's knee. It is actually caused by overuse of the knee joint or trauma, which is directly hit the patella or the surrounding of the knee. Okay, the symptom of the patellofemoral syndrome is pain when bending the knee, which is when you bend the knee, you will feel the sickness of the knee and and it sounds cracking or popping sounds. Okay, for the next injury, we have the iliotibial band friction syndrome, also known as IT band friction syndrome. It is known as a pain and tenderness on palpation of lateral side of knee, superior of the joint and inferior to the lateral femoral epicondyle. It is considered as a non-traumatic overuse injury. It is mostly caused by poor flexibility of muscle and training errors, which is the lack of the training exercises. Okay, for the symptom, the patient will feel the sharp pain on the outer side of the knee, which is the outside of the patella, and the sensation of stinging or needle-like. Okay, for the third injury is knee bursitis. It is also known as inflammation of a small fluid-filled sac above the knee joint. It is commonly caused by overuse of the knee, osteoarthritis, and the bacterial infection of the bursa, which is located at the inside of the knee. Okay, for the symptom, uh, the patient will feel warm, tender, and swollen at the knee joints. It will also trigger stiffness and then discomfort when the patient walking.
Okay, next I will continue the presentation about mechanism of knee injury. Mechanism of knee injury on the basis of the information from the injury pattern to primary and secondary stabilizing structure plus bone injury pattern. We have a classic complex knee injury into 10 categories according to the knee position, flexion, extension, direction of force, the presence or absence of the retention. First is a pure hypertension, hypertension with varus, hypertension with valgus, pure varus, flexion with valgus, external rotation, flexion with varus, internal rotation, flexion with posterior tibial transflexion, patellar dislocation, and last direct trauma. Okay, next is hypertension injury. Hypertension injury by fracture of the greater force exerted on the tendon or lock knee produce more pronounced bone injury pattern, often with a plain fracture, several dislocation injury on the posterior exit side of the joint, common with the pattern. This injury particularly serious in they involve the critical posterior medial and or posterior lateral corner of the knee. Okay, next is flexion injury. Flexion injury, unless combined with a significant axial load, tend to the show few contiguous impatient bone injury but have a greater tendency to produce injury due to internal or external rotation. Non-contiguous impatient bone bruises are usually found as well as a small aversion bone bruise. We have observed the flexion injury with rotation show a greater association with medical tear than the hypertension injury. Okay, next is pure valgus and pure varus. Pure valgus and the rare pure varus category are characterized by the simple curvicle pattern of the infection, bone injury, and opposite side detraction ligament injury. Okay, next is patellar dislocation. Dislocation of the patella is typically produced by combined flexion, valgus, and external rotation of the femur of the feet tibia. In theory, this is a very simply to the flexion, valgus, and the external rotation. Until we have chosen to the separate the two pattern on the basis of the different injury patterns. Okay, last is direct trauma. Direct trauma is characterized by broad bone contusion located beneath the site of the infection. Typically, the not injury on the opposite side of the knee. Direct anterior trauma which cause patella and trolar growth, contusion, and lateral or medial blow are most common.
patient lying in supine position with test knee fully flexed. Then rotate the tibia medially and bring the knee into extension. Next, repeat the process a couple of times with different angle of knee flexion in order to test the whole posterior aspect of the lateral meniscus. To test the medial meniscus, bring the knee into full flexion and laterally rotate the tibia. The patient is in supine lying position and bring the patient test leg in 30 degrees of flexion. Then fixate the femur with the outer hand and bring the tibia into slight external rotation. Then try to pull the tibia anteriorly. Firstly, make sure the patient in supine lying position and flex the hip to 45 degrees and knee to 90 degrees. Fix the position by slightly sitting on the patient foot. Then palpate the joint line and push the tibia posteriorly in an explosive movement.
Assalamualaikum and hi, my name is IZZATI NABILAH BINTI YUSNIZAN. So I will present about do and don't during special test, which is about the knee. So we can move to the do. Okay, first of all, we must basic accessory movement test of the knee most suitable. The second one, before we want to start the special test, we must wash hands. So after that, use clean and safe equipment, or we can choose a suitable place or safe place to do a special test. Okay. So the next one is ask the patient first before doing special test. Okay, we can move to two. Okay, first of all, we don't place too much pressure on the patient. So next, don't over stress when checking patient's needs. So we do not have to give some stress to the patient because we know the patient is sick. So we can do not pressure the patient. So next one is don't bend the knee until forcing the patient. We can't do forcing a patient because we know patient is sick and we can ask him or her where the injury is. Okay, that's all from me. Thank you.
Equipment for knee test is first for this five test, it require a bed or flat surface so that the patient can be treated comfortably. Second is squat walk test. Squat walk test need a flat surface, and make sure when you want to start the test, wear a sport wear.